Ischemic stroke. So first of all, what is stroke? You already get some idea from the previous video, but just to make it more clear. We have a brain, and all of the brain obviously has blood vessels. If some of those blood vessels would clot, there would be no blood flow through some area, part of the brain would die. Without blood, any tissue would die. The brain is no exception. So this is generally similar to the heart attack. Yes, when we have no blood flow through the coronary arteries, we have heart attack. Yes, we have myocardial infarction. In case of the brain, if you do not have a blood flow, we have stroke. Simple like that. What is the most common reason? The most common reason for ischemic stroke is like in myocardial infarction, the atherosclerotic plaque that bursts, and we have blood clot. Yes, so we have first some atherosclerotic plaque, and then it leads to blood clot that blocks completely blood flow, and part of the brain dies. So, what can be signs and symptoms of it? Generally, if you think about anything that is controlled by the brain, so quite a lot of things, all of it can be damaged. Of course, there is some connection between place and signs and symptoms. You read it in the presentation. I will get you the most important things. So, for example, you know already where is the motor cortex, yes? And generally, in the parietal lobes, most of it. So, if the motor cortex is affected, obviously, the effect will be paralysis. If the optic vision cortex, yes, in the occipital lobes will be affected, it may lead to the situation that the patient would be blind. If the areas that control hearing in temporal lobes, for example, will be affected, patient can get deaf. If it would affect, for example, frontal lobe, the patient would have problems with abstract thinking, higher emotions, things like that. And so on, and so on. So there may be sensory losses, there may be something like psychiatric diseases, maybe depression, maybe generally anything that you'd think about. Yes. So, what else? What else we need to think about? Of course, generally, what is most concerning you are a couple things. Primarily, the pathologies of the movement that are very common. So, what is this? Is it upper motor neuron syndrome or lower motor neuron syndrome? This is upper motor neuron syndrome because the upper motor neuron is dying. And to be more precise, the upper motor neuron that is in the motor cortex or the beginning of its axon. So, for example, you know that motor neurons get their axons through the brain, yes, through the internal capsule to the spinal cord. So, as we already explained this in some other videos, as far as I remember, when the lesion would affect the internal capsule, the effects would be far worse than if it would affect only the motor cortex. Why? Because the density of the axons in the internal capsule is far higher than the density of the cell bodies in the motor cortex. So it would affect far more muscles and the situation of the patient will be far worse. What other thing? You already know also from the first of the lessons that we have the decussation of pyramids. What is the effect of it? The effect of it is that when we have the stroke on the left side, we would have the, for example, paralysis on the right side. Yes. So when we have this paralysis, we need to rehabilitate the patient. And this is extremely important. So your role in treating the patients after the stroke is extremely important. And as I said, there may be myriads of problems with such patients. Still, brain has some plasticity, and a lot of those things can be treated, at least to some extent. Mainly, thanks to you, mainly by the rehabilitation. So patients need to relearn things that was lost. Needs sometimes to relearn how to get the balance, relearn how to speak, how to swallow. It's also need to be learned sometimes. How to speak, how to walk. Yes, you need to fight the spasticity, and so on and so on. Of course, it's rare that everything could get back to normal. If everything could get back to normal after 24 hours, this is called TIA, and this is not the real stroke. But never mind. But generally, there are myriad of conditions, and for really a lot of those, you can help. Okay, thank you.